Culturally competent assessment for Indigenous populations in Canada, ensuring safe and respectful interactions in healthcare. Understanding Indigenous populations in Canada. An overview of Indigenous communities. Indigenous populations in Canada include First Nations, Inuit, and Métis people, each with distinct cultural identities. These communities are spread across urban and rural areas and represent a rich diversity in languages, traditions, and governance structures across Canada. More than 1.8 million people in Canada, or 5% of the population of Canada, self-identified as an Indigenous person on Canada's 2021 Census of Population. Indigenous peoples are the fastest-growing population in Canada. Between 2016 and 2021, the Indigenous population grew by 8%, while the non-Indigenous population grew by 5.4%. Historical context and impact on healthcare. Roughly 1 in 5 Indigenous people report experiencing unfair treatment, racism, or discrimination from a healthcare professional. The history of colonization and systemic discrimination has led to profound distrust towards healthcare systems within Indigenous populations. Historical traumas such as residential schools continue to affect health outcomes today, resulting in significant disparities in access to culturally competent care. In addition, there have been immense mental health disparities among Indigenous people. These disparities are rooted in historical factors such as colonial policies that have had adverse direct and intergenerational impacts, as well as contemporary factors such as access barriers to mental health services. The importance of a culturally competent assessment. The integration of culturally appropriate and safe care is defined as care that reflects the values, traditions, and social norms of a patient's culture and where patients feel respected, safe, and valued. It is important for the Canadian healthcare system to recognize and integrate traditional knowledge, therapies, and healing practices into the treatment approach for Indigenous people. This could include things such as sweats, medicine circles, and smudging groups. Providing safe, culturally competent, and respectful care is vital in order to improve health outcomes among vulnerable populations across Canada, such as Indigenous communities. Common issues in healthcare interactions. Indigenous patients often report feeling unsafe during assessments due to culturally inappropriate questions or lack of understanding from healthcare providers. This can lead to avoidance of care and worsening health issues within these communities. Racism, discrimination, and marginalization are other issues that the Indigenous population of Canada must face when accessing health services. Personal motivation for choosing Indigenous populations. My decision to focus on Indigenous populations stems from a place of responsibility as a future healthcare professional and a commitment to advocating for healthcare equity and equality. Recognizing the unique challenges faced by marginalized populations and the need for culturally safe and respectful healthcare practices across Canada is an important factor in achieving a safe and healing Canada for all populations and communities. Growing up practicing traditional Indigenous cultural practices and seeing firsthand the disparities Indigenous populations experience in the Canadian healthcare system has greatly affected how I wish to advocate for all marginalized populations in my future career. And the picture I have attached for this slide is a picture that's taken from my local powwow that I attend every summer called the Samson Powwow. Current evidence for assessment practices. Culturally safe assessment principles. Culturally safe assessments prioritize the dignity and identity of Indigenous patients. This approach is founded on respect, clear communication, and understanding of cultural differences, ensuring patients feel secure during their healthcare interactions. Indigenous health needs. The Canadian Indigenous population is predisposed to higher rates of preventable chronic diseases such as diabetes and mental health issues compared to non-Indigenous Canadians. Understanding these disparities is crucial for tailoring assessments to address specific health needs of Indigenous individuals. Recommendations from Indigenous health organizations. These organizations recommend using frameworks that respect Indigenous knowledge and practices. This includes collaboration with community leaders and adapting assessment tools to reflect the cultural context and history of Indigenous people. The following is a specific example of framework for mental health within Albertan Indigenous communities. Number 1. Understand the realities of mental health experiences for Indigenous peoples. Number 2. Design a holistic and culturally rooted mental health system. Number 3. Foster cross-sectoral engagement and collaboration on mental health service delivery. And number 4. Focus on children and youth. Effective communication strategies. Effective communication involves active listening, using plain language, and cultural sensitivity. Recognizing nonverbal cues and personalizing conversations are important in order to build trust. This then improves patient comfort during assessments. Enabling the involvement of families, trusted service providers, and community elders can support a more meaningful understanding of an individual's needs and its relation to cultural context and cultural roles. Trauma-informed care acknowledges the impact of trauma on Indigenous patients. This approach involves creating a safe environment, understanding trauma responses, and integrating patient history into assessment practices to provide holistic and respectful care. This is particularly important when treating or assessing Indigenous women who disproportionately experience violence when compared to non-First Nations women, as well as the ongoing impact of colonization, racism, and intergenerational trauma. Integrating evidence into practice. Culturally competent assessment tools. Developing these tools involves incorporating Indigenous perspectives, beliefs, and practices into healthcare assessments. These tools should be designed collaboratively within the Indigenous communities in order to ensure the relevance of the tools and that it remains respectful to the Indigenous cultural values. It is important when utilizing these tools that the provider keeps in mind the patient perspective, the community perspective, and the effective appropriate care of Indigenous patients within the Canadian healthcare system. Training for healthcare providers. Training programs should include cultural awareness of Indigenous health disparities and the use of trauma-informed care techniques. Continuous education ensures that healthcare providers are equipped to address the unique healthcare needs of Indigenous patients effectively. According to surveyed healthcare providers, engagement with Indigenous communities firsthand has been shown to be the most effective training method within the Canadian healthcare system. Building trust with Indigenous patients. Establishing trust requires understanding historical trauma and respecting cultural practices of Indigenous patients. Engaging in open dialogue and demonstrating genuine care fosters a therapeutic environment for healthcare interactions. Personal strategies for improvement. Incorporating moments for personal reflection can improve culturally safe assessment practices. Seeking input from Indigenous colleagues and community members promotes ethical and respectful care, driving personal accountability and growth in my future practice as a healthcare professional. Interprofessional collaboration. Collaboration among healthcare professionals is crucial to ensure safe and effective care for Indigenous patients. Sharing knowledge and cultural insights with fellow coworkers allows for better insight, leading to improved patient health outcomes and overall community trust. Conclusion. Culturally competent care that respects Indigenous traditions and values is very important in order to achieve therapeutic relationships with Indigenous populations of Canada. Healthcare experiences significantly improve when these assessments are conducted with understanding and respect for cultural background. The importance of culturally competent care. Culturally competent care is essential in building trust and ensuring that Indigenous patients feel valued and understood in the healthcare setting. This approach addresses intergenerational trauma, which remains prevalent in Canadian Indigenous populations today. Call to action for healthcare providers. Healthcare providers must commit to continuous education regarding Indigenous health issues and remain active advocates for systemic changes. Utilizing culturally competent practices promotes patient safety and maintains ethical standards in the Canadian healthcare delivery. The future directions for Indigenous healthcare involve integrating Indigenous knowledge into current healthcare practices and policies. This includes many different aspects, with the most important being cultural awareness and collaborative practices that focus on Indigenous communities and their voices throughout the process of providing care.